With AccuGuide, it's very easy to use the program to identify the volume on an impacted tooth and its relationship with the nerve. So we can use the program not only to plan implants, but also to work on impacted teeth. For this, we need to draw a panoramic curve, which we can limit to the lower right side of the jaw. We've been drawing a nerve. We can show the nerve here. And I'm going to segment images. So we, by default, have a threshold on the bone at 500 ounce fill value. When I go with my mouse all along the bone, I see that the bone is very dense, the tooth, which is impacted there too. I click, and then I just created a new image. I can remove the top also. So I go to the lasso. I select the bone, lasso, remove what's inside the lasso, and I am going just to remove the teeth which are in contact with the lower teeth. For some reasons, some radiologists do not separate the lower and the upper jaws, and this is really bad for us because we absolutely need to do that if we want to have a very clear image of the surface of the teeth. So the image has been treated, the mask has been treated. I am going to add a second mask. The second mask will be the tooth, impacted tooth mask, and the mask is coming here. If in between the bone and the tooth we have some attachment, then the tooth will appear related to a big image of the bone. So let me remove that. Let me go to new teeth. And we are going to take two levels. The first level is that when you increase that, you remove the bone, but at the same time, you remove some particles of the tooth. So I would like to stay in between, and I am going to stay at around 1,300 or 1,014. 400. And then I have a tooth. The tooth is very simple to build up. And this is the tooth, and you see the relationship in between the roots and the tooth. Now, I am going to go to the full mask of the bone, and I'm going to use minus. I am going to remove the tooth. I am going to calculate and validate. And then, if I make a right click, the bone will appear around the tooth, and then I will get the tooth, which is impacted, inside the bone, and I can play on this image to see the bone, to avoid seeing the bone, and to see the relationship in between the tooth and the bone. That's the way to do.